Meet Shoveling Sam. He is a trades assistant helping out with construction of one of the new Curtin University car parks. His role involves many manual handling tasks, some of which he finds are a breeze, yet others are back-breaking. Sam must perform a variety of manual tasks in order to keep himself looking busy. Sam enjoys these kinds of activities because it requires him to use his body to complete the task, and he gets to work on his beach muscles at the same time. Unfortunately, Shoveling Sam is a bit sloppy, and the new GEM OT students are worried that they won't have a car park done before semester 1 begins. The OT students know that musculoskeletal injuries such as back pain, upper limb disorder, and hernias are the most common health problems that occur during manual tasks. Shoveling Sam is in the occupation group that experiences the most workplace injuries, with musculoskeletal injuries being the most frequent in that group. The OT students couldn't help but notice Shoveling Sam's poor technique and immediately set to work analysing his body movements while he was shoveling sand. At his ankle joint, Sam performs frequent dorsiflexion and plantar flexion through normal ranges. He is unlikely to sustain an injury here unless there is a sudden inversion or eversion movement of the weight-bearing foot. This is most likely to occur if he was to become unbalanced, such as when walking over an uneven surface or stepping on an unexpected obstacle. He is more likely to obtain a sprained ankle with an inversion movement or by rolling outwards, as the lateral ankle ligaments, the anterior and posterior talofibular ligaments, and the calcaneofibular ligament are less stable than the medially located deltoid ligament. Sam's knees move into flexion and extension controlled by the hamstring group, with involvement of the gracilis, gastrocnemius, and sartorius, and the quadriceps group respectively. Soft tissue injury is unlikely in this scenario unless unexpected forces are applied to the joint in a mediolateral or rotational direction. As this is a repetitive task, ensuring correct patella tracking is very important. There is a tendency for the patella to be pulled in an anterior lateral direction due to the angle of the femur and dominant forces from the vastus lateralis. This is a concern as the patellar ligament runs vertically, and incorrect tracking can result in irritation and inflammation, resulting in patellofemoral pain. Ensuring correct strength balance between the vastus lateralis and the vastus medialis muscles will allow for correct patella tracking. Sam's shoveling action requires him to be in a prolonged flexion at the hips. This involves the iliopsoas muscle group with the involvement from the rectus femoris, sartorius, and pectineus. This contributes to the viscoelastic creep of the soft tissues of the lower back. Sam's postvertebral muscles act bilaterally to hold his torso flexed forward for extended durations. These muscles include the erector spinal group, which are the main stabilizers of the spine in a bent forward position. Due to the prolonged duration of this task, Sam may experience viscoelastic creep, causing strain of the ligaments and connective tissue supporting the lumbar spine. Due to the nature of these tissues, they will stretch to enable the forward flexed posture, but take a long time to return to their normal length. Because of this, Sam's intervertebral discs are exposed to greater pressure and they are at risk of rupturing. As Sam moves his body forward, gravity pulls his trunk into further flexion. This is then controlled through the eccentric contraction of the erector spinae muscles and assisted by the hip flexors. Sam is also repetitively rotating at the trunk to move the load. This places great strain on the internal and external obliques as well as the unilaterally contracting postvertebral muscles and may lead to ipsilateral postural imbalances. Every time Sam lifts a load, his trunk is returning to extension. This is initiated by posterior tilt of the pelvis and concentric contraction of the erector spinae group. Sam's upper arm must perform many different movements in the shoveling action, including extension, flexion, adduction, and abduction. To enable Sam to perform gross motor movements at the upper limb, his rotator cuff and posterior shoulder muscles must engage to stabilize the shoulder joint. Rounding the shoulders for extended periods of time while shoveling can lead to aching and imbalances within the muscles associated with the shoulder and its girdle. For example, as rhomboids are usually weaker than other muscles within the shoulder girdle, they can struggle to pull the muscles back to an adducted position. Furthermore, the overuse of the rotator cuff muscles can lead to tendinitis, ruptures, and even chronic joint pain. Muscles in Sam's forearm that will be involved in the shoveling movement include the supinator, pronator teres, and pronator quadris muscles. These muscles are responsible for the rotation of the forearm. Repetition of this movement over a long duration may lead to irritation and pain at the proximal forearm and may result in an overuse injury. Both extrinsic and intrinsic muscles of the wrist and hands help to enable the correct grip to ensure safety when shoveling. Extrinsic muscles allow a tight grip on the shovel, whilst intrinsic muscles enable fine motor actions such as flexion and extension of the palm and phalanges. Shoveling Sam must maintain a prolonged flexion of the neck, which creates an abnormal kyphotic posture, which places strain on the posterior located splenus capitis and splenus cervicus muscles, and also increases pressure anteriorly on the intervertebral discs. This can lead to cervical pain syndrome, more commonly known as neck pain. Sam can stand with his feet hip-width apart. This will increase his base of support and allow his center of gravity to move as he transfers the load. This position allows Sam to bend his knees and take the load through his bigger, more powerful leg muscles while saving his lower back tissues from the viscoelastic creep. Keeping the shovel close to his body will ensure the load is kept within the base of support and reduce the strain placed on his lower back. Rather than twisting to move the load, Sam can turn his feet and walk to the position he wishes to place it rather than throwing it, to minimize the likelihood of him sustaining an injury. For example, by wearing enclosed work boots that have a thick and supportive soles, Sam can minimize the likelihood of having a sprained ankle due to uneven surfaces or obstacles. Furthermore, supportive work boots will enable Sam to maintain the natural arches within his feet to have optimal mobility whilst working. Sam should also use the correct shovel for the work he is completing. For example, using a shovel that allows firm and safe grip on the handle is essential. Furthermore, using a shovel with a long shaft will prevent Sam from stooping, whilst ensuring that he is using the correct blade for the job will ensure efficiency to prevent Sam shoveling for longer than needed. It is also recommended that Sam pace himself throughout this strenuous work by taking breaks, keeping hydrated, and stretching before and throughout the shoveling. This will minimize Sam's chances of sustaining a soft tissue injury and fatiguing his muscles. Sam can consciously use a technique known as abdominal bracing, where the abdominal muscles, the rectus abdominis, external obliques, internal obliques, and transverse abdominis, are activated to protect and stabilize the spine. Sam can also warm up his muscles before beginning the work by marching on the spot, completing shoulder and neck rolls, or taking a brisk walk for 5 minutes. After working for 20 or 30 minutes, it is advised that Sam stretch out the major muscle groups. For example, Sam would benefit from performing hamstring, hip flexor, back extension, and chest stretches to ensure that the muscle groups do not become too tight and inflexible. As the likelihood of requiring a shoulder or upper limb injury is high, it is important that Sam strengthens the muscle within his arms and shoulder. He can achieve this by completing exercise with weights or an elastic stretch band. Sam can loop the stretch band on a door handle or stable object and work his shoulder muscles by standing front or side on towards the door and stretching the band across his body for 3 sets of 8. Specifically, to work the infraspinatus and teres minor, Sam can stand facing the door with his arm abducted to shoulder height with his elbows at a 90-degree angle. He will then alternate between this position and rotating anteriorly at the glenohumeral joint. If Sam follows all the recommendations of the OT students, it will minimize the likelihood of him sustaining a shoveling-related injury.